HHA Practice Test 2026 Home Health Aide, Full Course Legal Responsibilities of an HHA. Question 1. What is the legal term for threatening to touch a person without their consent? Assault, battery, negligence, slander. Assault is the threat or attempt to injure, battery is the actual unauthorized touching. Question 2. An HHA accidentally gives the wrong medication to a client. This is an example of malpractice, negligence, assault, fraud. Negligence is the failure to provide the expected standard of care, resulting in harm or potential harm. Question 3. If an HHA witnesses another worker stealing from a client, they must keep it a secret to stay loyal, report it immediately to their supervisor, ask for a share of the money, tell the client to be more careful. HHAs are mandated reporters for illegal or unethical actions involving clients. Question 4. What is the HHA's role regarding informed consent? The HHA obtains the signature on the consent form. The HHA explains the risks of surgery. The HHA ensures the client is aware of the care being provided and agrees to it. The HHA decides what's best for the client. HHAs should ensure clients understand and agree to the daily care activities they perform. Question 5. Which document specifies the client's wishes for medical care if they become unable to communicate? The care plan, advance directive, birth certificate, social security card. Advance directives like living wills or health care proxies outline a person's medical preferences. Question 6. Scope of practice refers to the length of the HHA's shift, the specific tasks an HHA is legally allowed to perform, the distance the HHA travels to work, the client's favorite hobbies. Scope of practice defines the boundaries of what a professional can and cannot do based on their license and training. Question 7. True or false? An HHA can legally perform a sterile dressing change if the client asks. True. False. In most states, HHAs cannot perform sterile procedures. This is usually the role of a licensed nurse. Question 8. Sharing a client's private photos on social media is a violation of HIPAA. Privacy rights, professional ethics, all of the above. Posting client information online is a major legal and ethical violation. Question 9. An HHA who fails to lock the wheels on a wheelchair, causing a client to fall, may be guilty of assault, battery, negligence, false imprisonment. Failing to follow safety protocols that lead to injury is considered negligence. Question 10. What should an HHA do if they are asked to do something they weren't trained for? Try their best anyway. Politely refuse and explain it's outside their scope of practice. Ask the client's neighbor for help. Watch a YouTube video and then do it. Safety requires working within your training and legal scope. Question 11. The Patient's Bill of Rights applies to only hospital patients, only nursing home residents, all clients receiving health care services, only wealthy clients. All healthcare consumers have fundamental rights regardless of the setting. Question 12. Falsifying a timesheet is an example of fraud, malpractice, libel, battery. Fraud involves intentional deception for personal or financial gain. Question 13. Restraining a client without a doctor's order is good for safety, false imprisonment, standard procedure, the HHA's decision. Restraining a person against their will without legal/medical authority is false imprisonment. Question 14. What is the first priority when an HHA suspects abuse? Confront the abuser. Ensure the client's immediate safety. Call the client's friends. Wait for more evidence. Protecting the client from harm is always the first priority. Question 15. Liability means being late for work, legal responsibility for one's actions, being able to lift 50 pounds, a type of insurance. Liability is the legal obligation to account for your conduct. Question 16. An HHA should document care once a week, immediately after the care is provided, before they provide the care, only if something bad happens. Timely and accurate documentation is a legal requirement in healthcare. Question 17. If a client offers a cash tip, the HHA should accept it happily, refuse it politely according to agency policy, take it and buy the client a gift, demand more. Most agencies prohibit accepting gifts or tips to maintain professional boundaries. Question 18. Defamation of character in written form is called slander, libel, battery, assault. Libel is written defamation, slander is spoken defamation. Question 19. The primary purpose of HHA regulation is to protect the public and ensure quality care, collect taxes, make the job harder, provide jobs for supervisors. Regulation ensures that caregivers meet minimum standards for safety and competence. Question 20. Abandonment occurs when an HHA goes on a scheduled lunch break, leaves a client who requires care without a proper handoff, quits with a 2-week notice, calls in sick following agency protocol. Leaving a client who needs supervision without ensuring another caregiver is present is abandonment.